Measuring blood pressure is next, and it can be a little difficult at first. It will take practice, but it is extremely important to measure blood pressure accurately.
Blood pressure is the force of the blood pushing against the walls of the blood vessels. When you measure a blood pressure, you are measuring two things: systolic pressure and diastolic pressure. The systolic pressure is the pressure at the time when the heart contracts and pumps blood into the arteries. The pressure is highest at this time. The diastolic pressure is the pressure at its lowest point, when the heart is relaxed. In healthy adults, the normal systolic pressure ranges from 100 to 140 millimeters of mercury. The diastolic pressure ranges from 60 to 90 millimeters of mercury. Many elderly persons have high blood pressure, called hypertension. Low blood pressure is called hypotension. To measure blood pressure, you will need a sphygmomanometer or blood pressure cuff. This is an aneroid blood pressure cuff. It has a cuff that wraps around the arm. There are different cuff sizes. It is important to use the correct cuff size, as using a cuff that is too wide or too narrow will result in an inaccurate reading. The bulb is used to pump air into the cuff. The valve is used to release air pressure from the cuff. The manometer indicates the amount of pressure in the cuff. The long lines represent 10 millimeters of mercury. The short lines represent 2 millimeters of mercury. For example, this reading is 120 plus 2 short lines for a reading of 124. You will also need a stethoscope, 4 antiseptic pads, and a pen and paper to record the result. Be sure to wash your hands before giving care.
Mrs. Brown, it's Virginia Daniels. May I come in?
Please do, yes.
Identify the person and tell her what you are going to do.
I'm going to measure your blood pressure, all right?
Okay.
Have her rest comfortably, either sitting or lying down. Provide privacy. Lower the side rail if necessary. The left arm must be bare up to the shoulder and should rest comfortably on the bed or arm of the chair. Unroll the cuff and loosen the valve on the bulb. Be sure the compression bag is completely deflated. Then wrap the cuff snugly and smoothly around the arm, about 1 inch above the elbow. The cuff should not be able to rotate around the arm or slip down. The arrows on the cuff should point toward the brachial pulse, located here. Be sure the manometer is in position so that you can read the numbers easily. Locate the radial artery and palpate for the radial pulse. When you feel the radial pulse, close the bulb valve by turning it clockwise, and quickly inflate the cuff until the manometer reads 50 millimeters of mercury. Then, continue to inflate the cuff in increments of 10 millimeters of mercury until you can no longer feel the radial pulse. Read the manometer at this point. This reading indicates the palpated systolic pressure. Make a mental note of this reading. Deflate the cuff by turning the valve counterclockwise and have the person raise their arm and flex their fingers. Finding the palpated systolic pressure in this way will prevent you from underinflating the cuff when measuring blood pressure. To prevent the spread of infection, wipe the earplugs of the stethoscope with the antiseptic pads. Then wipe the diaphragm. Put the earplugs of the stethoscope into your ears. With your fingertips, find the brachial pulse on the inner side of the arm. Hold the diaphragm of the stethoscope firmly against the skin without touching the cuff. Close the valve by turning it clockwise until it is tight. Holding the stethoscope in place, squeeze the bulb to inflate the cuff. Inflate the cuff until the manometer shows a pressure 20 to 30 millimeters of mercury above the palpated systolic pressure you noted earlier. Turn the valve counterclockwise to allow air to escape slowly. Listen for the sound of the pulse to return. Be ready to note and remember the manometer reading when you hear the sound. This is the systolic pressure. The systolic pressure in this case is 136. Continue to let the air out slowly. Be ready to note the pressure reading when you hear the pulse sounds change to a softer or faster thud or disappear. This is the diastolic pressure. The diastolic pressure in this case is 80. Now, for practice, listen for the systolic and diastolic pressures. When finished, deflate the cuff completely. Record your reading. Indicate which arm was used and whether the person was lying, sitting, or standing. Write the systolic pressure above the line and the diastolic pressure below the line. If there is a change in the blood pressure, report it immediately. Remove the cuff and roll it up over the manometer. Wipe the earplugs and diaphragm of the stethoscope with antiseptic swabs. Raise the side rail and be sure the person is comfortable. Finally, remember to wash your hands after giving care and return the equipment to its proper place.
Measuring vital signs is an important skill that must be learned and practiced. The measurements you take enable you and other members of the healthcare team to provide the highest quality of care possible.